the CVS action plan.
Hmm.
And I think this is a huge resource for not just patients, but medical professionals because everybody can use this tool
Hmm.
because it's a really good guideline for when to take your medications, acute, preventative. You know, if it starts to get too much that you might need to go to the emergency room, what your steps before going to the emergency room. So I think it's a good stoplight representation of you're feeling fine, you're not doing so well, it might be time to go to the ER. Because that's a question we get a lot too, is when should
Hmm.
I go? And I'm always going, if you're asking, you should probably go. We've seen this action plan and it is available on the CVSA website, but can you give me kind of your point of view on it?
Sure. I think action plans are great because, like you're saying, you have to know what to do and when. And sometimes going to the urgent care or ER is going to be really easy. It's down the street, you have good access to it. Sometimes it's not. And so having some kind of guidance that you can use to self-actualize, you can make decisions on your own, is great. Obviously, you still have your doctors and nurses to call or to send messages to ask, but you should have the ability to manage your own symptoms to a point. And an action plan is a framework for doing that. And Patrick Reeves really has championed this in GI and developed action plans for different conditions. And cyclic vomiting syndrome, he championed as well. And it's great because the same framework applies where you have certain symptoms and you need to take certain actions. We use this in asthma, we use this for headaches, but cyclic vomiting syndrome is the same. What do I do on a daily basis to keep things under control? That's your green zone. Everything's going okay. If something changes, how do I identify that change? And what do I do next on my own? That's that yellow zone. And so it's individualized, which I think is great. This particular version uses pictograms or pictures as well as text. So you can, depending on which you prefer and which makes the most sense to you, use either kind of information to make those decisions. And it's something you can bring with you. So you have your action plan for yourself, but maybe the urgent care or the ER or your primary care doctor needs that also to understand what you're going through and what your plan is. So it's a great resource.